Phosfomycin, a powerful weapon in the fight against common infections, is gaining recognition for its unique mechanism of action. By targeting the bacterial cell wall synthesis, phosfomycin disrupts the growth and reproduction of harmful bacteria, ultimately eradicating infections. With its distinct approach, this medication has become a valuable tool in combating a wide range of bacterial infections, including urinary tract infections, respiratory tract infections, and skin and soft tissue infections. In this video, we will explore the mechanism of action of phosfomycin, its effectiveness against specific pathogens, its clinical applications, potential side effects and precautions, phosfomycin resistance and its implications, and the future prospects and developments in phosfomycin research. Understanding the mechanism of action. Phosfomycin's mechanism of action involves inhibiting an essential enzyme involved in bacterial cell wall synthesis. This enzyme, called enolpyruvyl transferase, is responsible for catalyzing a key step in the synthesis of peptidoglycan, a major component of the bacterial cell wall. By inhibiting enolpyruvyl transferase, phosfomycin disrupts the formation of peptidoglycan and compromises the integrity of the bacterial cell wall. As a result, bacteria are unable to maintain their structural integrity and are more susceptible to the immune system's defenses. The unique mode of action of phosfomycin sets it apart from other antibiotics. Most antibiotics work by targeting specific components or processes within bacteria, such as protein synthesis or DNA replication. However, phosfomycin's ability to disrupt cell wall synthesis makes it effective against a broad range of bacterial species, including both gram-positive and gram-negative bacteria. This versatility is particularly valuable in the treatment of infections caused by multi-drug-resistant bacteria, where alternative treatment options may be limited. Phosfomycin's mechanism of action also contributes to its effectiveness in eradicating infections. By inhibiting the synthesis of the bacterial cell wall, phosfomycin prevents the formation of new bacterial cells, halting the spread of infection. Additionally, compromised cell walls make bacteria more vulnerable to the immune system's attack, allowing the body to clear out the remaining bacteria more effectively. How phosfomycin works against common infections. Phosfomycin's unique mechanism of action makes it an effective treatment option for a variety of common infections. One of the most well-known applications of phosfomycin is in the treatment of urinary tract infections, UTIs. UTIs are primarily caused by gram-negative bacteria, such as Escherichia coli, which are susceptible to phosfomycin. By targeting the bacterial cell wall synthesis, phosfomycin effectively eradicates the bacteria responsible for the infection, leading to symptom resolution and improved patient outcomes. In addition to UTIs, phosfomycin has also shown efficacy in the treatment of respiratory tract infections. This includes infections caused by both gram-positive and gram-negative bacteria, making phosfomycin a versatile option for various respiratory infections. By disrupting the synthesis of the bacterial cell wall, phosfomycin inhibits the growth and replication of bacteria in the respiratory tract, helping to resolve the infection and alleviate symptoms. Phosfomycin's mechanism of action also makes it effective against skin and soft tissue infections. These types of infections are often caused by a variety of bacteria, including both gram-positive and gram-negative species. Phosfomycin's ability to disrupt cell wall synthesis hampers the bacteria's ability to grow and spread, allowing the immune system to clear out the infection. This makes phosfomycin a valuable tool in the management of skin and soft tissue infections, especially when other treatment options may be limited. Phosfomycin's effectiveness against specific pathogens. Phosfomycin has demonstrated effectiveness against a range of bacterial pathogens, making it a versatile treatment option. In urinary tract infections caused by Escherichia coli, phosfomycin has consistently shown high rates of bacterial eradication. This makes it an attractive first-line treatment option for uncomplicated UTIs, especially in cases where antibiotic resistance is a concern. In respiratory tract infections caused by Streptococcus pneumoniae, phosfomycin has also been found to be effective. Streptococcus pneumoniae is a common pathogen responsible for respiratory tract infections, including pneumonia. Phosfomycin's ability to disrupt cell wall synthesis inhibits the growth and spread of this bacterium, leading to improved patient outcomes. Phosfomycin has also shown efficacy against methicillin-resistant Staphylococcus aureus, MRSA, a notorious multi-drug-resistant bacterium responsible for skin and soft tissue infections. MRSA infections can be challenging to treat due to their resistance to many commonly used antibiotics. However, phosfomycin's unique mechanism of action makes it an effective option against MRSA, offering hope for patients with these difficult-to-treat infections. Comparing phosphomycin to other antibiotics. When comparing phosphomycin to other antibiotics, its distinct mechanism of action and broad spectrum of activity set it apart. Unlike many antibiotics that target specific components or processes within bacteria, phosphomycin's inhibition of cell wall synthesis makes it effective against a wide range of bacterial species. This versatility is particularly valuable in the era of antibiotic resistance, where multi-drug-resistant bacteria pose a significant threat to public health. Furthermore, phosphomycin's unique mechanism of action makes it less likely to induce resistance. Resistance to antibiotics typically occurs when bacteria develop mutations or acquire resistance genes that confer protection against the drug's mode of action. Since phosphomycin's mechanism of action targets a fundamental process in bacterial cell wall synthesis, it is less prone to resistance development. This makes phosphomycin an attractive option for the treatment of infections caused by multi-drug-resistant bacteria. In terms of side effects, phosphomycin is generally well tolerated. Common side effects include gastrointestinal symptoms such as diarrhea, nausea, and abdominal pain. These side effects are typically mild and resolve on their own. However, as with any medication, there is a potential for more serious adverse effects, although they are rare. It is important for healthcare professionals and patients to weigh the potential benefits and risks of phosphomycin before initiating treatment. Clinical applications of phosphomycin. Phosphomycin has a wide range of clinical applications due to its versatility and effectiveness against various bacterial infections. In addition to the treatment of urinary tract, respiratory tract, and skin and soft tissue infections, phosphomycin has also been used in the management of intra-abdominal infections, bone and joint infections, and even as a prophylactic agent in certain surgical procedures. In the management of intra-abdominal infections, phosphomycin's mechanism of action allows it to target the bacteria responsible for the infection and prevent further spread. This can help reduce the risk of complications and improve patient outcomes. Similarly, in bone and joint infections, phosphomycin's ability to disrupt bacterial cell wall synthesis makes it an effective option for eradicating the infection and promoting healing. As a prophylactic agent, phosphomycin has been used to prevent surgical site infections in various procedures, including colorectal surgery and orthopedic surgery. By administering phosphomycin prior to surgery, the drug can help reduce the risk of post-operative infections, leading to improved patient recovery and outcomes. Potential side effects and precautions. While phosphomycin is generally well tolerated, there are some potential side effects and precautions to be aware of. Gastrointestinal symptoms, such as diarrhea, nausea, and abdominal pain, are the most commonly reported side effects. These symptoms are usually mild and resolve on their own. However, if they persist or worsen, it is important to seek medical attention. Rare but more serious side effects can occur with phosphomycin. These may include allergic reactions, liver dysfunction, and hematological abnormalities. If any unusual symptoms or severe side effects occur, it is crucial to stop taking phosphomycin and seek immediate medical attention. Phosphomycin should be used with caution in patients with renal impairment, as the drug is primarily excreted through the kidneys. Dose adjustments may be necessary in patients with reduced kidney function to avoid the risk of drug accumulation and potential toxicity. Phosphomycin resistance and its implications. As with any antibiotic, the emergence of resistance to phosphomycin is a concern. While phosphomycin's unique mechanism of action makes it less prone to resistance development, it is not immune to the problem. The spread of phosphomycin resistance can limit the effectiveness of this valuable antibiotic, particularly in settings where multi-drug-resistant bacteria are prevalent. To mitigate the development and spread of phosphomycin resistance, it is crucial to use the drug judiciously and in accordance with local resistance patterns. This includes appropriate prescribing practices, ensuring the correct dose and duration of treatment, and considering phosphomycin as part of a combination regimen in certain infections. Ongoing surveillance of phosphomycin resistance is also essential to monitor the prevalence and trends of resistance. This can help guide treatment decisions and inform antibiotic stewardship efforts to preserve the efficacy of phosphomycin for future use. Future prospects and developments in phosphomycin research. As the prevalence of antibiotic resistance continues to rise, the need for effective treatment options remains critical. Phosphomycin's unique mechanism of action and broad spectrum of activity position it as a promising candidate for future research and development. Ongoing research aims to further optimize the use of phosphomycin, including exploring combination therapies to enhance its efficacy and combat resistance. Combination therapy with other antibiotics may provide synergistic effects, allowing for lower doses of each drug and potentially reducing the risk of resistance development. Efforts are also underway to develop new formulations and delivery methods for phosphomycin, including extended-release formulations and combination products. These advancements may improve convenience, dosing regimens, and patient adherence to treatment, ultimately enhancing the effectiveness of phosphomycin in clinical practice. Conclusion: the role of phosphomycin in combating common infections. In conclusion, phosphomycin's unique mechanism of action and broad spectrum of activity make it a powerful tool in the fight against common infections. By targeting bacterial cell wall synthesis, phosphomycin disrupts the growth and reproduction of harmful bacteria, ultimately eradicating infections. Its effectiveness against a wide range of pathogens, including multi-drug-resistant bacteria, highlights its value in the era of antibiotic resistance. While phosphomycin is generally well tolerated, potential side effects and precautions should be considered. Furthermore, the emergence of phosphomycin resistance underscores the importance of appropriate prescribing practices and ongoing surveillance. Looking ahead, ongoing research and developments in phosphomycin hold promise for optimizing its use and expanding its clinical applications. By harnessing the power of phosphomycin and exploring new avenues for its use, healthcare professionals can continue to combat common infections effectively and improve patient outcomes.